So I'm Margaret Fire-Robin, and I am with Family Promise of Bristol and Bristol's Promise, but if you note Melissa Roberts, that we are changing our name to Appalachian Promise Alliance. So we went through several different names, so I have to be sure I get the one that is correct. So we're very excited that we're changing our name to reflect better our service area. So anyway, and I see several folks who are here for the first time. We welcome that. This meeting started in March of 2020 in response to COVID and where things were changing weekly, if not daily, for what services were available and provided and who was open and what hours and all kinds of things. So we continued that on a weekly basis for some time, then went to every other week. And now we are once a month with Bristol Coalitions, which Lynn Pinnell works with, that's primarily focused on Bristol, Virginia services. They meet on the second Tuesday and we meet on the fourth Friday. They have gone back to in-person, but hybrid, I think, opportunity, and we continue on Zoom. And at this point, think we will be continuing on Zoom. It's handy for everybody and it's a good way to come together. And we're Tennessee and Virginia focused. So we welcome everybody, and thank you, Melissa, good job. And so our format is that we definitely share, and please put your information in the chat, but we'll have opportunity for folks to give any updates, any changes in services, events that are coming up, etc. And some of the time we do have a program, and today we are very pleased to have a program. I'll also say that Family Promise of Bristol has a Tennessee State Health Department grant, and our grant is to build our coalition of folks who are responding to COVID and who are prepared to continue to respond to COVID or other pandemics. And so y'all are that coalition. And we will probably be working to formalize some agreements, et cetera, and use this forum to be sure that we're on top of everything along those lines. So also United Way of Bristol received a grant from the Health Department, Tennessee State Health Department as well. And they'll be updating us for what theirs covers. It's different from ours. Also with our coalition, even though it's the state of Tennessee Health Department, we know where we are. We cannot do things without and serve our folks without it being the Tennessee and Virginia work. So we will continue to include everybody in our processes and in our work. So with that, and please feel free to also put questions, and Karen George is with Family Promise of Bristol and is a great tech person and also is working with the State of Tennessee Health Department grant. Melissa Roberts is Exec Director of Appalachian Promise Alliance. I want to say network so bad. Alliance, and she has been huge in facilitating these meetings as well. So y'all can help monitor chat if I'm missing anybody's questions. We'll also have opportunity. People can speak up and raise your hand or speak out is fine as well. So today we wanted to provide an update. We're entering the fall season with we already know lots of infectious diseases going around. I can name several friends of mine who have tested positive for co-workers who are testing positive for COVID or have it in their household. So we know we're not done with that, and there's still the unknown of we don't know who's going to get really sick and who's going to have a light case. It's difficult to determine. We certainly believe vaccinations help us have lighter cases, but people can still get pretty sick. So, and we have all the other infectious diseases, that the ones that we usually have, plus throw in there a little monkeypox as well. So we have asked Mount Rogers Health Department if they would help us look toward the future, see where we are, what do we need to be doing. And so we have grateful to have Cindy Jones with us today. And Cindy is a registered nurse, has been for 43 years. A good bit of that time she has been working with infectious diseases, and she is now with Mount Rogers Health Department. And let's see what else. Some other experience in emergency obstetrics, and she's a lifelong resident of Southwest Virginia, and she's really proud to be a grandmother and have 4 grandchildren. So Cindy, we welcome you. We know we usually have representation from Mount Rogers, but this is, I think, your first time to join us today, so
Definitely.
we appreciate you very much. And I think you were going to share your screen and talk to us. So whenever you're ready, hopefully that's still set up to do that.
Okay. Can you see me now?
We
I mean,
can.
Okay.
Beautiful. Yep.
All right. So I kind of use this picture because I think this is a beautiful time of year in our beautiful area. I think we live in one of the most beautiful places on earth. And so just a bit, I am from Mount Rogers Health District, and it covers 6 counties and 2 cities. Washington County and Bristol City are connected at the Tennessee line, but we do go all the way up through Bland and Wythe and Carroll. Occasionally I might speak of Southwest region, and that's kind of from Roanoke down, because with the health department there are some things that is done by region. Some of our infectious diseases of concern right now that we're seeing are the influenza, the RSV, the COVID, and monkeypox. And then I will tell you, I've been on a couple calls already this morning, so some of the information that was correct yesterday has changed just a little bit overnight, but I'll update that as I go. And there's a couple other things that they talked about this morning that I'll mention. So the first thing is our seasonal influenza. We know that this is something that we get every year. It has been decreased in the past 2 years, probably due to, one, not testing as much for flu because we've had the pandemic of COVID-19, but also people social distancing, things being closed early on, masking. So the flu numbers for the last couple of years have been decreased. But we do know also that the numbers are rapidly changing. Just this morning, I changed it that Southwest Virginia has a high level of influenza, where before it was low yesterday. So I changed that here. The largest group with flu right now is 0 to 9, and flu A is what we are seeing mostly. And there have been no reported outbreaks in Southwest Virginia. And that's real important to know, that hopefully we're catching the cases earlier, people getting treated with antivirals, and you know, staying home when they're sick and doing the things that we'll talk about that should be done. You can see here the signs and symptoms that are mentioned. These are not new signs and symptoms that we've not seen in the past couple of years, because as you can see, a lot of these signs or things that we see are the same as COVID. And that's why it's really difficult right now with what people are feeling or seeing and how it's starting. Is it COVID? Is it flu? Is it RSV? Is it just a cold? Is it allergies? Lots of questions people have. So as far as prevention of the flu, the biggest thing is to get your flu vaccine. Those are available. There is what's called a quadrivalent, which has 4 flu strains in it. There's also one for age 65 and above that has a little extra in it to help with the immune system, but it's also quadrivalent. So they usually make this based on the research they find in the Southern Hemisphere early on. So we are hoping that it's going to be a great match this year, that we can keep a lot of flu out of our systems by getting a vaccine. The vaccine's very important for anyone 6 months and older, and especially if you have a high risk for severe disease. And those high risks are really the same as they were with COVID, which is young children, pregnant women, chronic health conditions, asthma, diabetes, heart disease, lung disease, and being older. As you know, the older population has poor immune systems, and it's harder for them to fight something off once they get exposed. The best time to go ahead and get your flu vaccine is now, before the end of October, but know that you can get it any time because our flu season goes through usually through May. And in this area, we have seen outbreaks occur as late as April and May. So it's never too late to get one if you don't get it now. These vaccines can be found at your health department, at pharmacies and physicians' offices. They're readily available. There should be no shortage. And in other ways to prevent getting the flu, one is to practice what we call good respiratory hygiene and cough etiquette. And that's basically doing what our moms taught us several years ago. Cover your mouth when you cough, or cough or sneeze in your elbow, in your sleeve. Wash your hands. If you use a tissue, throw it in the trash, then wash your hands. Don't touch your face. This is what we call the T-zone, your eyes, nose, and mouth. And that's where all respiratory illnesses get into your body, is right in that T-zone. So as we're touching things, not always washing our hands, then as soon as we touch our face, therefore, we just pass it right through to our respiratory system. Frequent hand washing. I know we've all been practicing this, we've been teaching this, but it really is one of the biggest things for any type of infection, is to keep our hands clean. And another thing that we've been preaching through healthcare, and I know for me through infection prevention and control at facilities, is if you are sick, stay home. Don't go out in your groups, don't go to the store, don't go to the movies. It's just, if you're sick, it's best to stay away from other people. And for the flu, they ask that you do not return to work or school until you're fever-free for at least 24 hours without the use of fever-reducing medicine, and or 4 to 5 days. You're contagious up to 2 to 4 days at least. And then after that, if you're still very symptomatic, you either need to wear a mask or stay at home. And then to sanitize high touch surfaces, doorknobs, things in your kitchen, things that people touch frequently. We know that if we're not washing our hands good, we're just passing germs from place to place. And then there we go, we touch our face. And so that's why also we need to work on our immune systems in general. Lots of sunshine, good nutrition, lots of rest, light exercise. These all are things that help keep our immune system working properly. And that really does help us. So that would be just an overview of the flu itself. We get to COVID-19, and what we're finding are the numbers are decreasing. Hospitalizations are decreasing. We think this is probably from the vaccines themselves. We're happy to know that there's not been a major shift in the variant, so that's helping. We've learned a lot in the last 2.5 years and kind of know more of what to do. But things that you need to know is on the CDC website, they do what's called a community level. And these are based on, the community level itself is based on the numbers of cases, but also your healthcare system, how it can handle an uptick and or hospitalizations. Right now, all counties in the Mount Rogers Health District are medium, except Carroll With, and they're low. And I will tell you, CDC changes this on Thursday nights. So they just change it once a week now. And so you can check and see, it's every state. So you can check and see where you live, where you're going, what your community level is. And that will tell you what you may need to do to help protect yourself. When you're out and about, you want to know how close you're going to be to people, how long you're going to be with other people. Is it going to be a big crowd, a little crowd? Is the area well ventilated? We know now that for anything respiratory, outside is good. Open windows and open doors are good. It's if you have friends, are they up to date with their vaccines? And then know your vaccination status and your risk. If you're in the high risk category, then you might need to wear a mask longer. You might need to stay away from large crowds longer. So these are things that you need to consider when you're thinking of your COVID-19 risk. For when your community is low or medium, it is all of those things. Know your risk, know what your community is. But if you do test positive, the isolation, as you know, things have changed several times in the past 2.5 years. And I grant you, it's definitely been frustrating for us and the community. But right now, it's recommended that you isolate from everyone for at least 5 days or until fever-free for 24 hours. And then when you go out, you need to wear a mask for at least another 5 days. And if you are high risk or you choose to, it's still okay to wear a mask. Make sure it's a well-fitting mask. If it's a cloth mask, make sure it's washed frequently. Otherwise, you're going to make yourself sick. But there are lots of disposable masks available now, and that really does help. As far as the COVID vaccine, there are vaccines recommended for ages 6 months and up. There are a series of 2, plus we now have a new booster that's out there readily available. It's called a bivalent, meaning it has 2 strains in it, and one particular strain is the Omicron 4 and 5, which we know was part of our last surge. And so therefore, hopefully this is going to keep people from getting as sick, keep hospitalizations down. And we know it may not keep you from getting COVID, but hopefully it will keep you from getting sicker and having to be hospitalized. Again, your high-risk people, congregate care areas or long-term cares, we have a great concern for them. As you know, it's hard to keep people separated in those homes. Their immune systems are down. So we work with our long-term care and congregate settings very closely to try to help minimize their risk. These vaccines are readily available again, so please, if you need one, make a call. The health department has all of them, but also physicians and pharmacies. So hopefully that if you need one, you can certainly find one. So then we get to this question. So I've got these symptoms. What do I have? Do I have the flu? Do I just have a cold? Do I have COVID? That is the big question for everyone this day and time. So the only way to absolutely know is to do appropriate testing. And everybody will not get tested, and that's okay. If you're doing okay, you start to feel better in a couple of days, it's going away, you probably are okay, whether you have COVID and or the flu. But if you are high risk, if you're not getting better, if you're getting short of breath, do follow up with your physician or urgent care so you can get tested. There are antivirals out there for everyone, and that way we can hopefully keep people out of the hospital and back on their way to health. I wanted just a couple things about COVID and flu, how they're similar. The symptoms are similar. They're both person-to-person transmitted by respiratory droplets. There's vaccines for both. There are, again, there's antivirals for both. And there's complications that you can get from both. So those are things that are just, they're all the same, but there are a little bit of difference in how long the symptoms last. For flu, symptoms only last 1 to 4 days, usually. Now, you might have a call for something, and it might take you a while to get your energy back up. But again, the other thing about flu is it hits you hard. I like to tell people, if you've got the flu, if you wake up one morning and you feel like you've been hit by a Mack truck, it's probably the flu. COVID comes on a little slower. You start getting a little achy, a little scratchy throat, and then it starts getting worse. That could be COVID. And again, there's absolutely no way to know unless you are tested. For contagiousness. COVID is contagious 2 to 3 days before you ever have symptoms. Flu is about 24 hours before you have symptoms. And this has been one of the concerns and problems of trying to stop the transmission. You're out with people doing things and you feel fine. The next day you start having symptoms. Well, those people that you were with the day before, there you go, they've been exposed. So again, it's just real hard to tell, but if you've got these symptoms, you start feeling better, then you're probably okay. And it might not matter whether you had flu or COVID. But again, take care of yourself. There are over-the-counter things, and then see your physician if things are not getting better, or if you're high risk, and get those medicines quickly. The next one we'll talk about is RSV. We know it is RSV. It's respiratory syncytial virus. This has been kind of common in small children for several years. What we think we are seeing is the rise in numbers. As you can see on this graph, it has quadrupled since the 1st of September in numbers. The biggest threat is to our adults and our small children. Well, of course, it has to do with their immune systems, their respiratory systems, and it's just really, there are lots and lots of hospitalizations right now. I don't have exact numbers for our area, but most of our kids that are going to be hospitalized with RSV would probably go to Nice Wonder, and I know that they have a very high hospitalization rate in their children's part now. So it could be flu, it could be RSV. And I'll tell you that they can be co-infections, meaning you could have RSV and flu, RSV and COVID, COVID and flu. It's really a tough respiratory world out there right now. For small kids and adults too, you start getting short of breath, runny nose, wheezing, coughing. It's kind of like a cold. Most kids, within 1 to 2 weeks, it stays a cold. They don't get any worse. But if they start getting shortness of breath, or they start breathing different, like using all of their muscles instead of just a normal breathing pattern, decreased appetite, decreased activity, or they're short of breath to where they can't eat, they need to be seen immediately. And it is a virus. There's no treatment for it. You're going to be treating the symptoms. Like I said, most of them do just go away. But again, if they get worse, they definitely need to be seen and treated just symptomatically. A couple things here I'll put on treatment, because I'm as guilty as the next one about taking care of things at home as long as I can. You can manage the fever and pain with over-the-counter fever reducers, but for children, make sure we never give them aspirin. This can cause complications like Raynaud's syndrome, and so we definitely don't want that to happen. So children should never have aspirin. Only what we would call Tylenol or Motrin, ibuprofen, acetaminophen. And also, if they're taking these medicines, they need to drink lots of fluids. You can get accidental overdoses if the children are not drinking enough fluids. And then anytime that you think they need a cold medicine, you should give a call to the pediatrician and make sure that it is okay. Some things are not okay for children, and they may be marketed as that, but I would definitely still check with the pediatrician. What we do think we are seeing is adults we know have been getting RSV, but we haven't been testing for it like we are now. For COVID, healthcare facilities started doing what's called a 4-plex test. It had flu A, flu B, COVID, and RSV. So we are seeing a lot of positive RSVs in adults, but what they think in years past is adults have had it, they just thought they've had a cold, but then they pass it on to children. So we think that this may be the cause of the rise in numbers somewhat, but we do know that still a lot of children ages 0 to 9 are positive with RSV, and several are hospitalized for it. It's a respiratory virus, so we're going to do the same thing as we would for COVID or flu. Cover your cough, wash your hands, clean and disinfect surfaces, stay at home when you're sick. And if your child is sick with cold symptoms, do not send them to daycare. We do know that this is a problem for working parents. I've been there. We know that, well, I've got to go to work. It's probably just a cold, so can they go? But we do really need to keep them out of congregate settings such as daycare as much as possible. Some of the pediatricians have said that they thought the rise for pediatric cases could be because their immune systems are down. They've been inside for a couple years, not been out in groups. So hopefully that they can at least get outside, get some sunshine, and that would help decrease the numbers. And with RSV, you're usually infectious 3 to 8 days, or at least while symptomatic. So again, if children are sick with colds, with RSV, they need to stay home and stay out of schools and daycares as much as possible. Also, if you're working with daycares or preschools, talk to them about how often to clean, not sharing toys and activity things during this time, because we know kids like to touch things, touch their face, cough, and it's very hard to control all of that. So if you can not share things and clean in between, that is your best bet. We do know that RSV can stay alive on hard surfaces for several hours. This is my favorite picture. We all know these cute little darling babies who you just can't help but touch. You want to pick them up, you want to kiss them. If you're in a grocery store, you see a cute kid, you just want to touch those cute little feet. But what we should not be doing is that if it is not your child or in your family, you really should not be touching or kissing. Like I said, I'm guilty. We all love these cute little babies. But if it's your baby, you probably should avoid large crowds. And there is no vaccine for RSV. So really, all you can do is try to stay away from it as much as possible. Again, if it's not your baby, let's not be touching and kissing, as hard as that is. So we'll go just a little bit to monkeypox. Monkeypox is not new. It's been around and diagnosable for a long, long time, but it's not been in the United States much. It has been in some underserved areas. It is considered zoonotic. It comes from animals, but we have had what we've considered an outbreak since May in the United States, and it starts out usually as a rash and or a fever. It's in the same category as smallpox, and I know a lot of older people have had a smallpox vaccine. They quit giving those to the general public in 1972. So therefore, a lot of our younger people have not had that. It is transmitted by close contact. And I don't mean like basically just walking by someone. It has to be skin to skin. If someone has lesions, then therefore it is contagious. Right now we have it's 526 cases in Virginia. We've had a very limited amount in Southwest Virginia, and that is from Roanoke down. The way they put those numbers out is if it's less than 5, they don't publish those. But I will tell you, it's been minimal in Southwest Virginia. And there is a smallpox vaccination that we use for monkeypox now available. If someone is interested in it, there are certain criteria that have to be met. And this is based on the CDC, because the CDC is furnishing these vaccines. We do have to go by that criteria, but they have expanded it several times since we started. And if someone's interested in the monkeypox vaccine, they can call their local health department and get more information, because we are still giving it, we're still encouraging it, but the numbers have greatly decreased in the last 2 months. And I think that is probably because, one, we've gotten the vaccine out, but two, we've done a lot of education on how it's transmitted and what you can do to protect yourself. And I have a couple other things that I just want to talk about. First, that we talked about this morning, it's just something to be aware of. There is an avian flu in poultry that they're watching. They have found it in what they call black buzzards, and then backyard poultry, like people who have chickens in their backyard. It has been some in Southwest Virginia and again Roanoke down, but it's just something to be aware of. If you were to find a dead bird or something that you wanted to get rid of or just move, the biggest thing is to wear some PPE, wear some gloves, don't let it touch your clothes, and just to be on the safe side. Again, it's not anything that we have seen locally, but it's very low risk to people as far as transmitting from the bird to the person. But if you were to touch a dead animal or dead poultry, then make sure that you monitor for symptoms for 10 days. And if anything comes up, you can call your local health department for that. Environmental health can help, and also the nurses can help. And the other thing that you're probably seeing in the news, and I'll tell you what Virginia is doing, is Ebola. They have found outbreaks of Ebola in Uganda. It is now expanded to 8 of their districts, one of them being their main city. I think it's their main city or main district. I'm not sure how they describe that. We are considered low risk right now, but the state of Virginia, or all states actually, if you're coming from one of those districts in Uganda, you must come through one of 5 airports in the United States. From there, you are screened to be either low, medium, or high risk. And whatever state that you are landing in, whether you live there or that's where you're going to be, your state is notified and you are followed up by your local health department. This way, again, there's no cases in the United States. We're trying to be very proactive that if someone comes from one of those areas, that we stay on top of it. We watch for signs or symptoms. There are certain hospitals that can take those people who are symptomatic. I will tell you it has about a 50% mortality rate, meaning about 50% of the people do die once they get Ebola. So it's something that we definitely want to keep out of the United States. And we're trying to be very proactive, but all the local health departments in all states are working on this. Ballard in Johnson City would be our local facility that if we had someone who became symptomatic, they are prepared to take care of them and isolate and do. And they also work with their local EMS. If we know someone's in the area from one of these districts in Uganda, we would only call a certain EMS to protect all of them. And then we all have protocols that we would go by. So again, Ebola is just something to be aware of, to know that the CDC and your health departments, Tennessee and Virginia, are being very proactive in trying to keep up with what may be going on in their areas. So that's what I have. First, I want to say thank you for the opportunity, but also thank you to all our community partners and people who have supported the healthcare workers or healthcare facilities in the last 2.5 years. It has been tough, but we know we've had lots of support, and we do appreciate all our community partners in working with us.
Thank you,
So
Cindy.
I will take any questions.
Yep. And I think we've got one is, should people report the avian flu cases to Wildlife Center?
Only if I don't know how to get back.
Share, just stop sharing. Find your stop share and then you should be good. We're seeing your main screen, so if you can find your stop sharing.
At the bottom, the taskbar with like mute, stop video.
Oh,
Or at the top sometimes where it says stop share, I think. So while she's looking for that, just wanted to say during COVID, you got it. That sounds great. During COVID, we paralleled Tennessee, Northeast Tennessee and Southwest Virginia were pretty parallel. I think Virginia was a little slower on the numbers than Northeast Tennessee, but I think they ended up pretty closely aligned. Also, just in general, our health, Virginia ranks significantly better than Tennessee for general health. But the studies that have been done, or the data that shows, and if you pull that together, which ETSU's School of Public Health, Randy Wyckoff has done that with presentations, and we parallel the pretty well this region. It doesn't matter if you're in Tennessee or Virginia, the health data is pretty similar. So Cindy, a question that we had is just about avian flu. Do those get reported to wildlife centers to track them as well when people report that, or how do they try to prevent it through?
I did in our meeting this morning, yes, they are working on how to communicate. If you have something that you're concerned about, first of all, talk to your veterinarian and or call your local health department for your environmental health. They would be on top of it and know exactly what to do and what the situation is. But yes, they are working right now on communication, especially in Southwest Virginia, about how to process this and get the information out.
Great, thank you. Okay, anybody else have any questions or comments for follow-up? So Cindy, we thank you. I guess one thing I had probably for everybody, a problem in the past is a lot of folks' work policies really push people to come to work. So a lot of these folks here are probably able to do remote working that started during COVID, and a lot of that's able to be continued. And so if people are symptomatic or not doing well, but a lot of the clients that we work with are still working in places that they want them to come. So just, Cindy, you could answer, but also anybody else here, are we seeing any changes in those work policies where people are encouraged to take care of themselves and not, especially since CDC has lightened up their requirements? Yes. So which I know some of us kind of question the wisdom of some of that. Maybe it ought to be a little stricter. Anyway, so Cindy, do you want to say, are y'all seeing any changes in particularly manufacturing and retail, grocery stores, the folks that depend on their essential workers?
I actually think we have, especially because we have continued in Mount Rogers, we have continued to do case investigations on COVID cases, especially high risk healthcare, long-term care. And we do have a business side also, a group that, and I think once we do case investigations, we talk to them about isolation. If there is a concern that they might be asked to come back to work, we certainly can call that business and healthcare place, whatever, and give them our suggestions. Now, can we make them do anything? No. But once we explain, and I think where people have seen the contagiousness and have seen people, have to close businesses because lack of staff or a whole department or something, I do think that people are more conscious. Now, I do understand also that not everyone gets paid when they're out, and that is a concern also.
Okay. Thanks. That sounds like y'all are a resource to help with that if folks are particularly seeing that repeated or hear concerns, that our health departments can be helpful with that. So yes. Also PPE, you mentioned that it's available. Do folks have places that's still available at little or no cost?
Well, we, through the health department, we do help, and we have the emergency coalitions. They help with health cares, assisted livings, group homes. As far as individuals, we do not have access to it for individuals, but I have noticed out in the communities that masks are much cheaper, gloves are available. So I do think it's there. And if you go in a lot of places, you can still go in and ask for a mask and they will give it to you.
Anybody else have any resources to add to that? Anybody else? Ellen, go ahead.
Yeah, I was going to say we still have PPE left over at the city of Bristol, Virginia, that we can provide. We provide it to certain places right now, like that are seeing the homeless population, that kind of thing. We have cleaning, masks, we have hand sanitizer, and we actually, I think the Public Works has some commercial PPE as well. So if anybody has any questions, they can reach out to me, and I've already put my information in the chat box, but we can help out if anybody needs something.
Great, we'll be in touch. Okay, well, Cindy, thank you very much. I'll ask, we'll stay with health for a minute. Does anybody else have health updates from Mount Rogers? I know we had a couple other people on. Ask y'all first, and then Cindy Rocket, get ready to give your update. So if nobody else from Mount Rogers has it, then Cindy Rocket from Crossroads, go ahead and give us a little update.
Okay, so Crossroads Downtown Clinic is open for business, and we're finding that we are having clinic here almost every day, although that's not the official schedule. But people can call our phone 276-466-1600 and get the weekly schedule. But doing that, still doing our mobile medical clinic, and things seem to be picking up. So we're real excited. Send the uninsured folks, our way.
Also, I guess I will ask, Melissa pointed out, and we tried to do a little bit last year, and we're behind in trying to do it this year. We're entering holiday season, and
yes,
frequently all of us here are out at least Thursday through Monday, sometimes Wednesday through Monday, and then Christmas for even a greater length of time possibly. So if you have a holiday schedule that you could share, so what do people do when they need you during that holiday time?
Okay, so we are closed Thursday and Friday for Thanksgiving, and then we're on skeleton crew the week between Christmas and New Year's, but there will be skeleton crew, there will be people picking up messages. So nobody should be without care. And if they're really serious, they can go to the emergency room.
Great.
Fair enough?
Yep, that sounds great.
Great, thanks.
So, all right. And next I was going to call on our, I wrote these down, cities, Christina Blevins, Ellen Tolton, if y'all can give us updates from city perspectives.
Ellen, I'll go. Well, good news. HUD has finally approved the Bristol, Tennessee action plan. So yay. So we have some funding for homeowner rehabs. If you know of somebody that you, potential family that's a low to moderate income family, we will be able to help them get HVAC systems and things like that in their home. It is getting cold out there, and a plethora of other things. So send them our way, and we can maybe help with that, alleviate some of that stress this winter. Otherwise, we have submitted our caper to HUD, and we're just kind of waiting to hear back on that, and programs are up and running.
All right. And y'all don't deal with emergencies, right? So holidays,
Well, we do have the emergency repair program, but as everybody here knows, when you deal with federal money, nothing is really quick. So even our emergency program takes some time, but it is faster than our other programs. So,
okay, thank you. Ellen?
Mine's pretty similar. We were a little bit ahead of Christina. We did get our approval of our annual action plan a little over a month ago. We have a very similar emergency home repair program for low to mod homeowners in Bristol, Virginia. And same thing, roofs, HVAC, windows, doors, that kind of thing. There's an application process. So again, if you know of anybody that might be eligible or interested, they can contact me. Again, we do have extra PPE, that's available, both here at City Hall and our Public Works. The other thing is it's been dwindling, but we still do have some monies. Both Christina and I have given CDBG money to United Way for those who are financially impacted by COVID. There is still money available for those folks, and they can contact United Way.
And that's for utility payments.
Yes, ma'am. That's for utilities, that kind of thing.
Thanks.
And I have also, CDBG has provided money to Bristol Redevelopment and Housing Authority for those who may be having trouble with their rent due to COVID. That has really not been a very popular program, but there is money there that's still available there. So if anybody has issues paying their rent in Virginia, Bristol, Virginia, due to COVID, they can contact, actually it's Lynn Pinnell.
Okay, great. Thank you, Ellen. So next I was going to ask about schools, but I don't see anybody from our schools on. Anybody need to say something from schools? And then I was going to call on Karen from Family Promise of Bristol. So Karen, you want to give an update?
Sure. We are still operating our day services, a place to be, out of the Salvation Army building on Tuesday, Wednesdays, and Thursdays from 9 a.m. until 3 p.m. We typically see about 35 to 50 guests per day. So services there are still going very well, and we're providing case management to guests that are willing and ready to take on those services. So,
and that's a whole lot of them.
It is.
Most folks do want case management, want support. Or some of them have expressed they don't want case management, but they want help with birth certificates and IDs and all the things that case management provides. So anyway, and we haven't finalized our holiday schedule yet. So that's coming, but I'm sure we will be there at least Tuesday and Wednesday of Thanksgiving week. So, and encourage, we'll confirm, but our shelters do operate during all the holidays. So they're always an option for checking with to see what services might be available. So, okay. And then veterans, I think we've got a couple of folks representing veterans. So if y'all can speak up, whoever's here with our veteran organizations. Chelsea.
Hello, I'm Chelsea Kalia. I work at the Mountain Home VA. So no major updates. I did want to let you guys know that our veteran program at the Salvation Army in Johnson City, as of this moment, is full. It's been a long time since that program has been full, but we are, that can change at any moment. So don't stop contacting us if you have potential referrals for that. Our domiciliary program, we're about 7 to 10 days out in order to get someone screened for that program. So it's just, that time of year where we're getting really busy. But if you have any veterans that are unhoused or needing some assistance with housing, certainly just reach out, and I put my contact information in the chat, so you can call or email me.
Thank you. Misty, do you want to add from Volunteers of America? Misty Underwood, she might be away from her desk. She can add in a minute. Just also to add, Family Promise of Bristol operates at the Salvation Army in partnership with them. It's been a great partnership. And we'll probably see if we can send our report, Karen, out to this whole group for when we have our October numbers, just if people are interested in what data we're collecting. But the shelters have been full pretty much the whole summer, which is unusual. Also, the numbers that we're seeing and the number of shelter beds available don't line up. So we are short lots of shelter beds, as well as we know we are very, very short in housing. So those are just some of the needs that we continue to see.
Can I jump in real quick and say one more thing, Margaret? Since Karen's on here, I'm planning to be at the Salvation Army next Wednesday around lunchtime. So between now and then, if you encounter any veterans there, let them know that I'll be there and I can talk to them.
Great. I'll let Sam know as well that you'll be there.
I'm pretty sure he should know. I've sent him an email,
Okay.
but I can send him another one to remind him.
Yeah,
Sounds
we'll
good.
make
Thanks.
sure that you're on the calendar. Also, just FYI, we do at the day services have different folks coming in to share information and provide some education. If any of y'all are interested, usually a 10 to 15 minute talk, and right now we don't have PowerPoint capabilities, and then answering any questions and then sticking around long enough. A lot of folks want to individually ask questions. So that's kind of the format that works well so far with the folks who are being served through that program. But we welcome folks coming in and providing information, and we want everybody to be sure we check out for veterans, because there are lots of services that are available for our veterans that are not available to the general population, and we need to be sure and identify those folks so that they can be connected to those services. So, and sometimes they don't self-identify. So anyway, okay, next I've got Bristol's Promise, and Melissa, do you want to introduce folks? And I know Erica also put in Bristol's Promise, which is Appalachian Promise Alliance, that's coming up. It has a fantastic newsletter that goes out every Monday. So if anybody wants to be added to that, be sure to put that in the chat. Or email Erica directly, but we'll try to follow up with the chat as well. So, Melissa.
Yeah, thank you, Margaret. So we continue to do all of the work that we have been doing, but I don't know if everybody has met Erica Ashford. I think that she's been on because she's been here for about 3 months now as our community collaborations manager, but we have a brand new, just this week, employee. Susan Turner is our positive and adverse childhood experiences program coordinator. So she's going to be building up the Northeast Tennessee Trauma Informed Care Network and doing trainings and all kinds of fun and interesting stuff. If you have not been trained in ACEs or resilience, please reach out to one of us and we'll make sure Susan gets that. And, you know, if you want to bring somebody in to do training for your organization or for, you know, your faith community, whoever, we would love to do that. So Susan, do you want to say hi to everybody?
I'm so scared to go off mute because they are working across the street and my dog is losing his mind. So I just want to thank everybody for the opportunity. I look forward to collaborating and working with everybody. And I'm just going to put a plug that Bristol Promise has been the absolute best. So thank y'all for having me.
Thank you, Susan. And I would, Melissa, you'll probably say, but training is available with Appalachian Promise Alliance in trauma-informed care, in ACEs, PACEs, resilience, building strong brains, and also DEI. So, and we operate on request, but also we should be scheduling some of those trainings to.
Yeah, we also have some parenting. We can also do car seat safety checks. So if you want to have a car seat safety check for your clients at your location, we can absolutely schedule that as well. So we do a whole host of things. As Margaret said, you know, if you're not already signed up for our newsletter, we send a newsletter out every Monday. And you can reach out to Erica for that. But also, if you have activities coming up, please also send those to Erica. We host a community calendar on our website and try and share all of our partner information to make sure that the community, you know, it's hard to get information to the community. So that's one of the things that we do. So feel free to send those calendar events to Erica as well.
Okay. Okay, and Village Behavioral Health note that Marissa sent, but let's see, John, are you also with the Village? John?
No, I'm with Creekside.
That's right. If you want to speak for a minute and share, that'd be great.
Yeah, I just want to give everybody, I'm in the process of moving, so I'm actually in the basement at my father-in-law's house. So it's a wonderful time to not have a house ready to move in. But just real quickly, I just want y'all to have a name and a contact. Creekside's in Sullivan County. It's on the Bristol side of Kingsport, kind of where the old Kmart used to be. But we're a 72-bed psych facility. We're independently owned. Summit Behavioral Health owns us out of Franklin, Tennessee. And we have a unit for adults, geriatrics, detox, and we have 2 kid units. We go all the way down to 9 through high school diploma. There's ways we can get the kids or some single parents coverage if they come to us. We're working on grant money. We've been here 4 years this month. We are for profit, but we don't have any big salaries like some of the big health organizations do. So we're it's a little more difficult to get grant money if you're listed as for profit. We do offer scholarships based on just the timing, because sometimes if somebody's in our facility and they need help and Turning Point's full and Woodridge is full, if they're with us, we will give them services. Usually we're keeping people 7 to 10 days and then passing them on to another behavioral health follow-up person to follow up with the care. But that's just kind of in a quick synopsis of what we do. But please keep my number, and if anybody has any questions, let me know, and I'll be glad to give them the information. Thanks.
Thanks and welcome. Okay, have I missed anybody else that has anything else to share? Amazing that we're just right before 12, which is what our goal is. So just a few things to remind is that we will send out, and I think we did not last time, but we'll send out the recording and the chat. And we are planned, so we're not going to meet on Thanksgiving Friday. So sorry, guys. So at this point, we're planning to meet December 2nd. So that would be our November-December meeting on the 2nd of December. Bristol Coalitions, as far as I know, they will meet Tuesday, November 8th. Their meeting is 12 to 1:30. Ours is 11 to 12. Occasionally 12:15. And as far as I know, they'll probably meet in December again too. So opportunity for us to catch up with each other at their meetings that time out better with holidays than ours do. And if you all have any speakers and or topics that are applicable for all of us in the work that we do, please you can go ahead and put that in the chat quickly, or message us, or send me an email, etc. We're happy to continue to have programs that are pertinent to all of us. So does anybody else have anything else? Karen, Melissa, did I miss anything? So I thank y'all very much, and Cindy's already left, but we appreciate her update, and certainly all of us need to be careful with all the infectious diseases. I know at the day services, we continue for staff to wear masks. We softly encourage folks there to wear masks, and I'd say 10 to 15% of folks wear them. We do have guests who do request masks and are caring about it. Salvation Army has had quite a few positive COVIDs, particularly with their communal living and sleeping in dormitories, etc. So anyway, all right. So thank you all very much, and we'll see you in December.